Okay, so illness name. Illness name for this one. Yeah, palpitation. Illness name. Just keep compliant. Just keep compliant palpitation. The pattern. Yeah, the pattern. What's the pattern for this patient? Pattern key sheet. Yeah, pattern key sheet. Everyone go to the same pattern. Okay, that's good. That's good. You are right. The key sheet. The key sheet. Yes. Yeah. So that's we say book case usually pretty simple. Yeah, usually pretty simple. They give us typically symptoms in there for key deficiency, and the palpitation is the key symptoms of the heart. So that's we say heart key sheet. Do you thinking about they have some like lung qi deficiency or maybe spleen qi deficiency? Yes, yes, that's why I asked the question there. So generally say, we say the body qi control mainly by two organs. One organ is the spleen, one organ is the lung. That's like a control all over body qi. But usually when we talking about the lung qi deficiency, we are not only talking about short breath. We may have other symptoms show up. So stiffness sensation in the chest, because this patient especially illness in the heart, so we couldn't only say that belongs to the lung. So we need other symptoms, like other key symptoms for lung cough, or maybe cough with phlegm. And for spleen qi deficiency, we're looking for appetite. I think we're talking about the poor appetite somewhere. Yeah. So basically, we're looking for poor appetite, and we're looking for the bowel movement. But they say bowel movement is normal. So still not particularly go to spleen qi deficiency. And the mainly symptoms go to heart. So if we make a pattern diagnosis for this one, we can only make a heart deficiency, not necessary to do the spleen qi deficiency and the lung qi deficiency. So we just mainly focus like chief compliant and what truly caused the chief compliant problems. Yeah. Yeah, this is talking about appetite has decreased. It's not truly like poor appetite in there, no abdominal distension in there. Okay. So treatment principle. Yeah, nursery heart, 25T, double palpitation. Yeah, that's good. That's good. another proof is a tonify heart key. There, yeah, copy this. So, but you say some population is still good, yeah. And the points, yeah, what points do you use for this patient? Yeah, what points do you use? Yeah, bladder 13, bladder 15, bladder 7, speed 6 is pretty good. Yeah, pretty good. Part 5, bladder 6, speed 6, sample for 36. Then 17, yes, good. Yeah. Yeah, part 7 in town. Then 17, Kakati 6, sample 56. Yeah, that's good. Yeah, that's good. Your voice is pretty good. Yeah, good voice. Bladder 43. Yeah, that's we talked about the motility voice. Yeah. The book voice pretty similar like your voice. They have bladder 15. And bladder 13. We talked about before. We say all over body heat controlled mainly by two organs. One organ is the lung, one organ is the spleen. So even we say the mainly pattern is the hard heat rate, but if we try to qualify heat, we also go to the lung, also go to the spleen. And another point is bladder 24. Anyone give some explanation for bladder 24 when use this point? Any idea? Yeah. C of the T. Yeah. It's back through of the T. Back through of the C of the T. T high through. Yeah. T high through. Yeah. Still T25. Yeah. And heart 7 we have especially working for the heart. And the spleen 6 we have. Yeah. So that's still T25. I like your voice in 17 there. I like your voice especially not on the book, like over the chest and review palpitation kind of condition. And certainly other points still good there. So that's for this case. Any more discuss for this case? It looks good. Okay, yeah. Okay, that's good. That's good, yeah. So when we go to clinical case, and then when we come back to book case, look like the book case is so simple, yeah, so easy. Okay. Okay, good. Okay, so Eoni's name for this one. illness name. Yeah, illness name. Yeah. Yeah, palpitation. Yeah, palpitation and toothache. Yeah. We can make a diagnosis for this one. So we say basically we try to use one diagnosis to cover all the symptoms. But truly, these patients, they have two chief complaints. One is palpitation, one is toothache. And they are not directly relationship each other. So we can make a diagnosis for this patient, palpitation and toothache. So the patterns, kidney yang deficiency, heart qi deficiency, and stomach fare invading the channel. Yeah, that's basically exactly the same on the book. Yeah. Palpitation, deficiency, toothache due to stomach heat. So heart yang deficiency, stomach heat, and gums. Okay. Okay, so let's discuss here. For these patients, more heart yang deficiency or more kidney yang deficiency here. Let's see the symptoms. So long time palpitations, several years palpitations. So we put a timeline here, few years, yeah, few years. And the toothache began with last week, yeah, 1 week. Yeah. So here is now. That's a few years. Yeah, few years. And the general constitution is weaker. So general constitution is weaker. Can coming from qi deficiency, can coming from yang deficiency, can coming from yin deficiency, or maybe blood deficiency, maybe essence deficiency. Yeah, just tell us it's the kind of deficiency case here, but we couldn't figure out what kind of deficiency. And the general lassitude, that's usually qi deficiency. And frequently, also these patients short of breath, that's qi deficiency. And the last week, that's from here. Yeah, last week from here has dry mouth and dry throat. I forgot my line here. Last week, development of painful swollen gums. We say gums basically belong to stomach. Yeah. No bleeding. Basically swollen, no bleeding, but painful, radiate to the neck, means more severe, and dry mouth, dry throat, and dessert to drink. So picture here together, we got excessive heat symptoms. Excessive heat in gums. So gums is the stomach channel there. So basically, if we're talking about the gas problems, we're thinking about the stomach. Some stomach heat maybe go to there. But food intake is normal. So if heat in the stomach organs, that's usually we're talking about stomach fare rushing up. But that kind of case, patient hungry loud and eating loud. So that means this kind of heat is in the stomach channel, not in the stomach organ. So that's 1 week. Yeah, 1 week. Is no difference, no stool for 3 days. That's internal heat. Yeah, that's internal heat. Patient have chronic sensation. Okay, patient has chronic sensation of cold and pain in the lower back and knee joints. So basically, that's the Yang deficiency size. My mouse is not under my control here. So Yang deficiency, especially on the lower part of the body, and the lower back is the kidney area, and the knee joints belong to kidney and the liver also. So that's basically we thinking about this case is kidney Yang deficiency. And some Qi deficiency size with palpitations. That's we talking about heart Qi deficiency. So the pattern we put together, yeah, the pattern we put together here, we say, heart Qi deficiency and kidney Yang deficiency and the local area for gum problems is the heat in stomach channel. You can separate it here. So that's in the book. Yeah, that's in the book. They put the stomach heat rushing up first. I couldn't change the order here, but on the book they put heat rushing up first. Stomach heat rushing up first, and then they talking about heart Qi deficiency and kidney Yang deficiency. I believe that because toothache is the acute problem, and the palpitation is chronic problems. So chronic problems is take some time, little bit difficult to treat deficiency there. So acute problems is little bit easy to treat. So that's why in the book they put actually they put a stomach fare, but I like to use stomach heat because no bleeding there. Yeah, stomach heat rushing up go to the channels. So that's the pattern here. And still see the tongue and the pulse here. Pale tongue, we say pale tongue can coming from Yang deficiency, can coming from Qi deficiency, can coming from blood deficiency. Certainly for these patients, it's mainly Yang deficiency and Qi deficiency. And with greasy tongue coating. So usually we talk about greasy tongue coating, like people have dampness or phlegm, they may have greasy tongue coating. But looking at all the symptoms here, we don't have specially like a dampness or phlegm signs. So that kind of which say body fluid disorder, it will coming from because yang deficiency, yang deficiency, and even qi deficiency can cause body fluid retention. But because they don't have other symptoms, go to here. So we are not go to pattern diagnosis for phlegm or dampness. And for the pulse, so very pulse, we still say can coming from pain, can coming from phlegm or dampness. So these patients mainly coming from painful situation, also can coming from liver. But these patients, we don't see the signs coming from liver. So that's coming from the painful situation. Because the gum pain in there. And the sleepy pulse, similar like a greasy tongue coating. So we're still thinking about it coming from yang deficiency. So that's basically for this pattern. Any more discuss for the pattern part or symptoms here? It looks good here. So certainly, heart qi deficiency and yin yang deficiency, that's the mainly reason cause the palpitation. And the heat rushing up in the stomach channel, that's cause the toothache and the gums swollen there. Okay, so treatment principle. Treatment principle. Yeah, nourishing, tonify, heart, warming yin yang, stop palpitation, clear stomach heat. Yes. Yeah. Tonify yin yang, tonify heart qi, stop palpitation, clear stomach heat, stop toothache. Yes. Yeah. Yeah, that's good. Yes. So like the older we're talking about the pattern diagnosis here, toothache is acute problem. And we try to put our pattern, the order number one, for try to treat the problems for toothache. So when we put our treatment principle, we still can put like a clear stomach heat, stop toothache for the number one treatment principle there. So I put the books treatment principle here. They use green stomach heat. I say in the book they use the fair in there. But basically it's not a too big difference. Fair is a severe kind of heat. So maybe people's idea a little bit different. With the fair rushing up, that's why in the book they use fair. But also fair is severe heat, will damage blood vessels and cause bleeding. But for this case, yeah, will be bleeding with fair. Yeah, will be bleeding with fair. But this case, they specially say no bleeding. Thus, I say you can use heat. usually the gum will be bleeding. But this patient is no bleeding, means the heat is not that severe. That's why I use heat instead of fair. But that's not that big difference, whatever heat or fair. Still heat, still heat. So that's number one there. And then tonify heart qi. So still palpitation, more relationship to the heart. So we still put tonify heart qi first. So the third aspect is, generally we say we will tonify yin yang, but right now the patient have stomach heat in there, so we are not truly tonify yin yang until the heat symptoms is resolved. So they say number 3, so yin yang not treat now until the heat symptoms so that's say too long here, but that's the same line. So that's drain stomach heat and tonify heart qi and yin yang not treat right now until the heat symptoms are resolved. So that's the treatment principle. And then the points, what points you use? Stomach 44, I4, LI 18, stomach 36, stomach 5, yes. Stomach 7, heart 7, heart 8, stomach 36, tooth 8, for stomach 6, I4, SI 18, stomach 44, yes. Part 7, part 36, then 14, bladder 15 for the heart, yes. You have good points there. Okay, I still put the book points here. Stomach 7. Stomach 7. And the stomach 44. And the pericardium 6. And ren 6. Stomach 44, LI11, heart 7, bladder 23, do 4. Like our treatment principle said, right now we are not specially treat yin yang deficiency. We're leaving that 2 points later, like stomach heat is clear. Then we go to bladder 23 to 4. Yeah. Yeah, for palpitation, bladder 15, and then 14, heart 7, cardiac 6, for the, yeah, just the kidney points we leave later. Yeah, kidney points we leave later. Stomach heat and constipation, stomach 7, stomach 42, liver 3, and 6, bladder 25. Yeah, yeah. Generally say your points is pretty good, but we say our points will match our treatment principle. Like we're talking about our treatment principle here. Number one is draining stomach heat. Yeah, number one is draining stomach heat. So that's like we're talking about. We must be have some points draining stomach heat here. So like we have some stomach 7 and some other stomach points, like stomach 44, that's good for draining stomach heat. And then we have points to tonify heart qi. So in the book, they use Palpitation 6 and Ren 6. But truly, like backroom of the bladder, of the heart, still good, like bladder 15, and other qi 25 points, like stomach 36, still good. Yeah. We just leaving the points. Yeah. So like here, these two go to the first treatment principle, and these two go to the second treatment principle. But certainly you can adding more points or changing some points for these two treatment principles. So Palpitation 6 is working for the heart. So in the book, is they talking about is a good points for regular heart qi, and dispersing the qi in the air of the chest is also calming the spirit. And especially they use with Ren 6 together, regular heart qi and promotion the qi. So that's why they use Palpitation 6 with in Ren 6 in here. Yeah. Heart palpitation with heart 5 will be more indicated. So basically, we will thinking about what caused the palpitation. Yeah. So heart and the pericardium, they both working for the heart. Yeah. We can pick up the points from the heart channel, and we can pick up the points on the pericardium channel. Yeah, yeah, pericardium 6, she have a short breath, like some pressure in the chest area. That's good for use pericardium instead of heart. Yeah. Yeah. But truly, we can use heart channel like heart 5, heart 7, and even back to points of the heart. Yeah. We can add in some points there. Yeah, that's the points. Yeah, that's points. Okay, that's for this case. Any more discuss for this case?
Jen, is yes. Toothache the technical diagnosis? Like it's not like some sort of obstruction there, right? So it's just Seems funny.
What do you mean is the diagnosis? The illness name or pattern?
Illness name, yeah. Like.
Illness name, just the chief complaint. Yeah, palpitation and toothache. Yeah, just the chief complaint.
Is that always going to be the case?
If not always, but truly palpitation is our TCM illness name, and the toothache still a case. We say if we can cover with one with others, we just use one. But for this case, these two chief complaints totally different problems. We couldn't cover each other. That's why we put two in here.
Okay.
Yeah. We still start from illness name. What's the illness name? Palpitation. Yeah, palpitation. Yeah, we are not necessary to put heart there. We can just say palpitation. Yeah. Yeah, palpitation is the illness name. When we're talking about the palpitation, we know that's the heart. We couldn't get the palpitation from other organs. Yeah. We don't have lung palpitation. We don't have stomach palpitation. Okay, that's everybody's illness name. No people have other name. No people say short breath. Why you not put a short breath there? Yeah, short breath is not the illness name. Yeah, it's the symptoms. So we can just say illness name palpitation. And your pattern. We got a heart yang qi deficiency. Heart yang deficiency. Heart yang deficiency. And lung qi deficiency. Question mark. Yeah. Where you put a question mark there? Yeah, it's truly for this case, mainly heart yang deficiency. Yeah, mainly heart yang deficiency. We're talking about palpitation. Yeah, palpitations is the key symptoms of the heart. When we're looking, people have palpitation. It must be some heart pattern in there. And then we're looking what kind of pattern in there. So for heart pattern, the deficiency part of the heart pattern, basically we have all the deficiency for the heart. We have heart qi deficiency. We have heart yang deficiency. We have heart blood deficiency and heart yin deficiency. When we go back for this case, we can see the patient have the mainly problems. Why is qi deficiency problems? Why is yang deficiency? So we say yang deficiency basically it will be covered. It will be covered qi deficiency symptoms. So sometimes we may only say heart-yang deficiency. But if we only say heart-yang deficiency, people may be thinking about more about cold size in there. But for this case, the patient has severe kind of qi deficiency symptoms. So then we can talking about qi deficiency. So we can say like heart qi deficiency and heart yang deficiency. But truly, we say we have two organs, mainly control, mainly control all over body qi. One organ is the lung, another organ is the spleen. So for key symptoms, when we're talking about the spleen qi deficiency, we're mainly talking about like a poor appetite, abdominal distension, and diarrhea. When we're talking about lung qi deficiency, short breath, and maybe cough with phlegm. So for this case, we say it mainly symptoms here is we're talking about one is palpitation, one is short breath. So even we put the illness name palpitation only, but short breath still a big trouble there. So that's we say this case we say heart yang qi deficiency and lung qi deficiency. So that's the pattern we can put two mainly pattern here. One is heart yang deficiency, one is lung qi deficiency. So when we put a pattern here, we expected we can cover most symptoms. Yeah. So looking for this patient, we have a big trouble here. So when we're talking about yang deficiency, means patient will have cold size. And truly we find some cold size in these patients. But the pulse, her pulse is rapid. Her pulse is rapid. When we're talking about rapid pulse, we always say heat. Yeah. Whatever external heat or internal heat, the pulse will be rapid. When cold, whatever external cold and internal cold, the pulse will not rapid. But how can we explanation for the pulse here? What's your opinion about the pulse? Why the pulse is rapid here? Is any heat inside? Yes. Yes, you are right. Yeah, yes, you are right. Yeah. Yes. Yes. Because heart qi deficiency and is so severe. Then the heart losing their mainly functions, pushing blood, go all over, like sending the oxygen, go all over. So like each pump, yeah, they couldn't send in enough blood. They just catching up by the rate. Yeah. So that means the rapid pulse is not coming from the heat. Yeah. Just the heart losing the functions. Okay, let's see. Do we have some other symptoms we couldn't explanation for this case covered by our pattern here? Yeah. Yeah, why people getting like a pain all over the bodies? It's qi deficiency, cold. Yeah, cold. So basically for these patients, because the cold blocking the blood circulation and some blood stasis there. Yeah. Yeah. So you look in the tongue, pupil color. We say pupil color tongue is the size of blood stasis. But we didn't put blood stasis in the pattern because compared with qi division size and yang division size, blood stasis is not that severe. Yeah, it's not that severe. But truly, cold caused some blood stasis and caused blocking the channels and caused body pain. Yes. Yeah, we try to explanation by the TCM. So blood stasis kind of tongue, we always talking about the pupil tongue, or maybe pupil start all over the tongue. And cold, if cold not that severe, usually we talking about the tongue, maybe pale, maybe little bit darker. And if they go to pupil color, means some blood stasis start already. But we may not necessarily put blood stasis for the pattern. We see like which side is more severe. Truly cold can make a blood stasis. It's a very close relationship there. Yeah, yang qi deficiency. That means internal cold. Severe kind of internal cold also can cause the blood stasis. We say we looking the symptoms, all the picture together. If only one side go to blood stasis, we are not put to the pattern. We talking about blood stasis usually cause the kind of sharp pain in the fixed location. That's and we're looking for the tongue, pupil color, and we're looking for the pulse, like a choppy pulse. Then we make for the pattern. But if only tongue or pulse in there, we just gave some explanation there, and we are not necessarily put to the pattern. Yeah, why people have poor sleep? Yeah, why people have poor sleep? Yeah. Yeah, when we're talking about, we say, when we're talking about heart pattern, we say key symptoms. Yeah, key symptoms. One is palpitation. Another one is poor sleep. Means any kind of heart pattern, Shen will be disturbed. Yeah, Shen will be disturbed. Whatever poor blood and qi deficiency or maybe yang deficiency or maybe yin deficiency, they will all have problems with people hardly to go to sleep or maybe wake up. Yeah. Yeah, blood and 神经都的. Yeah. Okay, so that looks like the old question here. Then your treatment principle. Yeah, treatment principle. Yeah, slow ball movement, but moisty. Moisty means no heat. Yeah. So if no heat there, this slow ball movement that's coming from qi deficiency. Qi couldn't push in. Yeah. If patient have like a dry stool and coming like a couple days, that's usually coming from the heat. But mostly it means some qi deficiency there, couldn't push it. Yeah. Okay. Okay, your treatment principle. Yeah, warming and tonify heart, young, relief palpitations. Yeah, benefit the lung, coming the mind. Yeah, tonify and warming young, coming the mind. Yes. Yeah, tonify heart, yang qi, coming the shen, stop sweating. I think we can just simply say tonify lang qi here. Yeah. But generally say your treatment protocol is good. Yeah, the books for treatment protocol, warming and tonified heart yang and tonified lung qi. Okay, so now your points. Yeah, now your points. What points do you like to use for this patient? Yeah, bladder 13, bladder 15, yes. Ren 17, good. Heart 7, good. Yeah. Heart 6, good. Ren 14, good. Yes. Maxa, yes. Yeah. When yang deficiency, maxa is very important. Yeah, maxa is very important. Lung 9 is good. Lung 7 is good. Stomach 36, yeah, good for this one. Ren 8, maxa, good. Yes. Yeah, maxa Ren 4 and do 4, yes. Yeah. Heart 7, lung 5, Ren 17, stomach 36 with maxa, that's good. Yeah. Yeah, heart 5, heart 7, cardiac 6. Yeah, your points is good. Yeah. Okay, let's see what's the points on the book. They use cardiac 6 on one side and lung 9 on other side and Ren 12. Ren 6 with warming needle. Stomach 36 with warming needle. Yeah, we can add points to totally kidney yang because kidney is the originally or all of our body yang coming from. So that's do for there. Especially marks on there is a good way to totally kidney yang. Yeah, so that's for this case. That's for this case. And certainly, patients like this for long-term treatment, I would like to suggest the patient use some herbs. And also pay attention. This case coming from China. Yeah, coming from China. So that means they can use acupuncture. They can use the herbs with Western medicine treatment at the same time. So patients is so severe that this. In Canada here, I believe they will go to hospitalize mainly or go to GP mainly, we may don't have a chance to treat this severe kind of case like this. But give us some idea how treat it. How treat it. Okay, good. Okay, unit name. Yeah, unit name. Yeah, palpitation. Yeah, palpitation. So we say mainly unit name will be the chief complaint if we have like TCM name there. Anxiety is not truly TCM name. So for this case, we can only put palpitation for unit name. So we say unit. And we truly palpitation for unit name. So that's the unit name. Okay, so the pattern. Kidney and heart disharmony, heart indifferency. Yeah, we have some other pattern. Young rising. Puberty stagnation and heat disturbing heart. Okay, so let's see the symptoms together. So recurrently anxiety, attacking with palpitation. For 2 years. So we say palpitation is the mainly key symptoms of the heart. Anxiety is kind of Shen disorder. All these main chief complaint or main problems go to the heart. And the patient also have irritability. So irritability sometimes we thinking about that's the liver symptoms, but truly it is heat symptoms. Just basically liver issue mostly easily caused heat, like liver qi stagnation, and then change to heat, then cause the irritability. But truly, any kind of heat can cause the irritability. But the liver issue certainly is more. And the stiff sensation in the chest, upper jaw, that's upper jaw issue, stiffness in there, and the short breath. Short breath is kind of a qi deficiency symptoms. Ten days ago, that's 2 years, that's 10 days, and the emotion upside, the symptoms happens again. So that look like still something look like go to the liver. We talk about emotions. But this time, reverse the euro, the patient come fever kind of sensation rushing up to the head. So that's still heat. Still heat. And with sweating. Sweating usually is heat pushing the body fluid to go out if internal pattern. Certainly, this patient is not an external pattern. No thirsty. Yeah, no thirsty means not that big heat. Yeah, not that big heat. Even we see a lot of heat cells here, but not big heat. And prefer cold food. Prefer cold food, still some heat cells. So together still heat in there. Poor appetite, usually we're talking about spleen qi deficiency can cause. No abdominal distension or discomfort. So that's we talking about spleen qi deficiency, abdominal distension or discomfort. So we have some spleen qi deficiency cells here, but not that severe. Restless. So restless still the size of the heat. And make it difficult to fall asleep. So people difficult to fall asleep still caused by heat. So this heat could be deficiency heat, could be excessive heat. But generally say if some people difficult fall asleep, that's heat size. And complain coldness and pain in the lower back. Urination is normal, bowel movement is normal. So usually if we're talking about the kidney issue, urination will be changing, maybe frequent urination, maybe night urination. And also we're talking about some weakness in the lower back and the knee. But for this patient, only have cold sensation and painful in the lower back. We didn't see other symptoms like a weakness kind of symptoms relationship with the kidney. So that means it's not a kidney issue in there. So that's where the cold and the pain in lower back coming from. That could be coming from like a passenger cold blocking the channels. It's not belong to internal reason, not belong to kidney deficiency. We didn't see other kidney deficiency cells in there. So that's we say kidney not in there. And the bowel movement are normal. So we see some spleen qi deficiency cells in there. Appetite is poor. And we have short breath in there, some qi deficiency cells in there. But no abdominal distension, no bowel movement disorder. So we say this kind of issue, spleen qi deficiency, is not severe in this case. So we're still not thinking about it. And slightly right hand body. So still a little bit heat, yeah, a little bit heat. And the thin and the white coating, we can think about normal. Basically, totally tall, we can think about normal. The pulse, yeah, the pulse, thin pulse, we say generally we're thinking about two issues. One issue is deficiency. Another issue, usually we're talking about maybe dumbness blocking. But for this patient, basically it's deficiency. We didn't see the dumbness signs, but truly we have a lot of deficiency signs, and we have a lot of heat signs. So that's the whole picture here should be a deficiency heat. And the mainly issue, for the heart, yeah. So we say deficiency heat in the heart. How about emotion? Emotion just a trigger, yeah, emotion just a trigger. We see some emotion signs here, look like we're thinking about the liver, but if liver mainly causes problems, we say hyperchondria pain. And liver fair or even liver young rising kind of situation, they will go to the head. Mostly issue like a red face, red eye, headache, dizziness, but truly in this case, mainly issue in the heart. So that's this pattern, yeah, this pattern. Finally, we got heart in phase. Yeah, so that's the mainly pattern. Truly, we have some signs go to spleen qi deficiency there, and some emotion stuff there. But the mainly issue cause the chief Kabbalah, or maybe cause the illness, is the heart in deficiency pattern here. Do you agree? So we are now thinking about the kidney and the heart disharmonize. Kidney and the heart disharmonize. That will we go to the pattern both heart in deficiency and kidney in deficiency. So that kind of case, we will talk about heart kidney disharmonize. So we need some kidney signs like weaker lower back, weaker knee, frequent urination, night urination, even 5 center heat, night sweating. So that's we talking about kidney and heart disharmonize. And liver yang rising, yeah, liver yang rising. When we talking about liver yang rising, we say that's the root deficiency. So deficiency part still in the kidney, or maybe liver in. And the yang rising part is some heat rising part. So this heat, it is a lot of heat size here, but this heat not truly rising up, like go to the head area. They mainly happens in the upper jaw, not go to the head. Mainly happens in the heart. And the liver qi stagnation, we talking about emotion, mainly distension kind of thing. So that's basically we are not thinking about other pattern here. Yeah, other pattern here.
Jin.
Yes.
But like in there, it says the patient complains of an episodic feverish sensation rising upwards to her head. So that's what made me think there was like a yang rising at that point.
Yeah, some we can say some heat rising up, but not truly cause the problems. Like usually we talk about liver yang rising. We talk about headache, dizziness, and some heat. Whole like a face is red, eyes is red. So that's mainly we talk about yang rising.
Okay.
Yeah. So any kind of heat, we can feel some heat inside the body. Yeah. To see they go to like how severe it is. Yeah. Yeah. Some more discuss for the symptoms and the pattern. Okay, treatment principle. Yeah, treatment principle. Yeah, nursing heart in, clear empty heat, yes. Stop palpitation, condition, yes. Yeah, nursing heart in, clear disease heat to condition, yes. Yeah. Yeah, so that's we're talking about nursing heart in, nursing heart in, clear. Diffuse heat condition. So that's our treatment principle here. That's the treatment principle here. Okay, the points. What points do you like to use for this case? Yeah, heart 6, heart 5 is good. Bladder 15, then 17, kidney 6. Yes, good. Yeah. Yeah, even we are not didn't talk about kidney issue here, but when nursing in, we can use kidney 6. Yes. Yeah. Bladder 43. Yeah, good. Yeah, kidney 6. Yeah. Bladder 14. Yeah. Bladder 15. Bladder 18. Yes. Bladder 20. Yes, good. Yeah, that's good there. Yeah, targeting 4. It's good. Yeah. Yeah, your points is good. I just give you books points. Give you some more choice there. Yeah, some question. Some question there.
For breakfast? Did you just have your breakfast?
Okay, I just give you book points and give you more choice here. It's pretty interesting for books points. They use 华佗假底。T4, T5, T9, T11, and T12. on the level of T4, T5, and T9, and T11, and T12. So that's so what would Jati points, they say generally say they can working with different levels and they can working with different situations. So basically they are pretty similar like we use breakthrough points. So that's why they choose what would Jati points there. Just give you another opinion here and another choice here. And then they use PC6. Yeah, PC6 on one side, this one needle there. And triple gel 5, yeah, 3 gel 5 on other side. So these 2 points is the both common points and the low connecting points. So they are on the opposite arms there. So means you can use one needle, go to other direction, look like your needle or working with both points. So that can help driving heat from the heart and coming shin. And another point, they use spring 4. So spring 4 is another connecting point and confluent points. Yeah. So both sides. So they can certainly tonify qi and regular middle gel. So that's the points used. Yeah. Yeah, what were Jiaji points? We can use similar like Baishu points. They are pretty close to Baishu points. So internal organs disorder, you can choose Baishu points, or maybe you can choose Huatuo Jiaji points. Certainly Huatuo Jiaji points is more safety compared with Baishu points. So that's one use we treat internal organ disorder. Another issue we use Huatuo Jiaji points, we can treat local disorder. Like we pick up different level Huatuo Jiaji points, treat like a local painful situation. But in this case, they use similar like Baishu points. So we say T4 and T5, that it mainly working for the heart in there. That's on the same level of the heart. And the pericardium. And the T9, yeah, T9, same level by true of the liver. Yeah. We didn't talk about good pattern for the liver, but truly some key issue cause the problems. So that's we go to the same level of T9 there. That's by true same level of the by true of the liver, bladder 18. And T11 is the same level of the backthrough of the spleen, bladder 20. And T12 is the same level of the backthrough of the stomach, bladder 21. So that's they just use Jiaji points instead we use backthrough points, but we still can use backthrough points. Yeah, lower connecting points usually working stronger, and they communicate like Zangfu internally and externally together. and they're working even better than other points. So we say we have 360 more points, but each treatment, basically we use something around 10 points there, even less. So certainly we try to pick up some more like stronger effective points. So that's we talking about, we use special points, like common points, 5 points, and low connecting points, C points, confident points, influence points, fundamental points, breakthrough points. So that's special points basically in each of our treatment plan. Like each of the treatment plan, we try to pick up some special, like powerful points. Low connecting points is very, very commonly used. And some low connecting points also belong to confident points, means they go to actual ordinary meridians. So that's basically